All right. Hello, everyone. This is Cindy Rubin. I am welcoming today a psychiatrist, but to introduce myself, I am a pediatrician and breastfeeding medicine specialist. So I see kids up to age 18, but I really focus on new moms and particularly during what we call the fourth trimester, which is a time when mental health issues do come up frequently. And so I think this is a very salient topic for my viewers. So I have invited Sarah Pospos, um, who is a psychiatrist, a perinatal psychiatrist. She is located in Los Angeles and has now a uh, practice called uh, Lifestyle Telepsychiatry. And she cares for moms who are in this period of time in this transition and helps them with all sorts of things that can come up, anything from burnout to sleep problems to how do I fit in exercise, um, to addressing specifically their mental health issues, and is really dedicated to taking care of this population. So I'm very excited to hear what she has to say. And she is actually in the fourth trimester herself right now with her second child. So probably adds a little interesting twist to how she feels about this. So welcome, Dr. Pospos.
Thank you so much, Dr. Rubin. Such an honor to be here. Thank you again for your time
Absolutely.
today.
Absolutely. And am I pronouncing your last name correctly?
Yes, yes, it's perfect.
Okay, good. I just want to make sure. All right. So first, I'm just curious to hear a little bit more about your practice and how you got into this particular niche.
Absolutely. So, in terms of how I get into perinatal psychiatry, I actually gave birth to my first in the middle of my medical training, psychiatry training. So it was during my third out of 4 year of psych residency, and it was in the middle of the pandemic when it just
Mm,
started, actually.
mhm, mhm.
So, when she was born, it's literally just my husband and I, 24/7 for the first 6 months, because obviously both of our families are far away and couldn't come visit and lend a hand. There's no childcare options because of the pandemic worries at that time.
Mhm.
Uh, and of course, being a first time parent and first time mom myself, there's a lot of anxiety, a lot of, just
Sure.
uncertainties, not knowing what to do, um, to add on top of all of that. So, with
Right.
that being said, I think what could be a better way to give back, but to focus on perinatal mental health as a psychiatrist, because then I realized firsthand how difficult and lonely of a place it can be, with a lot of
Yeah,
challenges that's out of our control as moms, new moms, and moms to be. And
absolutely. Go ahead.
oh, no, no, sorry, go ahead.
No, I was just gonna say it's interesting that you say it that way because I was just thinking about it more as I was preparing for this, um, live stream and thinking that that's such a key factor is that suddenly things are out of our control. They really are, and it's the first time for many of us to really feel that way,
Mhm.
and I think to still feel like we have control actually, but things are not going the way we expected them to go. It's kind of an
Right,
interesting nuance. Yeah.
definitely. Definitely. Like you
And
said, the feeling of being out of control, not knowing where this quote unquote normal would return, not knowing what to do for the first time ever, just adds
right.
up to those anxiety, stress, burnout, and
Yeah.
feeling of overwhelm in general as well.
Yeah, for sure, for sure. So, it's funny because I think that a lot of people end up in a niche because they themselves had a certain experience and want to help other people to make that experience run a little bit smoother. I know that's how I got into breastfeeding. So
Definitely.
sounds like similar. Actually, so I am curious how having baby number 2 has been in that context. Do you feel like it's been an easier transition, a tougher transition second time around?
That's a very good question. So, like you mentioned, I'm actually still in the thick of that fourth
Yeah.
trimester. Very recently pregnant and gave birth now, as of this recording, about 8 weeks ago.
Wow.
Um,
And she's already on our live stream.
right. Um, so, I think in terms of having baby number two, there's plus and minus in terms of how I'm prepared, I guess.
Mhm.
So the plus side of things is I know a little bit more what to expect in terms of those first few days after the hospital, how the delivery process might look like. Just in general, of course, we don't know what's going to happen during the delivery, but just in general in terms of the hospital check-in and what to expect and whatnot. Um, i we did a little bit of research in terms of the first few months as well during baby number one. So those kind of things are, kind of already being prepped for, so to speak.
Yep.
But as all of the moms out there know, no babies are the same, no kids are the same. So of course, even though we prep all we want, it always goes back to how the baby is gonna be once it's born, right? We don't have any control over the pregnancy itself, the delivery, the postpartum period, the breastfeeding if you choose to, just the developments. So it's that thin line between those two. I think it's a little bit
Sure.
hard to navigate that.
Yeah, yeah. So I'm curious. So obviously, every woman parent that you potentially see is different. But what are the things that you try to make sure that you address during this period of time to figure out how mom's handling it and also just your own education and support that you give back? What are kind of the standard sorts of things that you think are important to address?
Yes, very good question. I'm glad you bring it up. I think first and foremost is to recognize, what might happen in
Yep.
terms of what to expect, as well as recognizing if things started to go, quote unquote, wrong, or at least going in that
Mhm.
directions.
Mhm.
I want everyone to know that, postpartum, pregnancy, delivery, and postpartum, of course, it is very, very hard for
Yeah.
everyone, right? So it's very, very challenging times as is. And also in terms of mental health, it's very common during post pregnancy and postpartum period to experience things like postpartum blues, or commonly called baby blues. Even postpartum mood disorder like postpartum depression and postpartum anxiety are also very common mental health challenges that might come up during this period.
Mhm.
In terms of symptoms, it could be a range of things. So not, it's not the same for everyone, perhaps, but typically the common symptoms might include change in mood. There could be some irritability, feeling sad, crying spells, feeling anxious, worry that seems out of control or excessive and 24/7 about the baby or about other things, life in general. It could start impacting your sleep, for example, your appetite, your eating habits, energy. You might find it hard to concentrate, and things of the likes. So, even though it's very common and could happen to a lot of us, I think the key is to recognize two important red flags. So, first, if these symptoms start to, one, cause severe, intense distress in your life, or two, start to interfere in any way with your day to day. So that could be, your relationships, your work, if you're students, your grades, and things of the likes. Then it's very important to reach out for professional help, to reach out to your local psychiatrist, or to get help in that space, essentially.
Yeah. I mean, just to kind of hammer that point in. I mean, really, I think it's that first step that's so hard for so many people.
Mm.
It may take a while to realize what's going on and to realize that you need help, but then to actually reach out for it can be so hard for people. And so knowing ahead of time, I think that this is something that's very common and kind of normalizes it, I think can
Right.
be helpful. And knowing where your resources could be if you need them. So they're just a little easier to access if and when the time comes. And
Definitely.
even, your pediatrician, your OB, I mean, all of these people, if you don't have a mental health professional to reach out to whoever you have, and they can lead you to the right person.
Yes. Absolutely, absolutely. In the, thick of it, it could be a very lonely space, a very difficult space to
Yep.
be in when there seems like there's no way out. Because,
Yep.
mothering, parenting is a 24/7 jobs, right? There's no
Hmm.
break, there's no lunch break, there's no
Hmm.
vacation time, there's no quitting. But please realize that you don't have to suffer alone. Help is just a click, an email, a phone call away.
Hmm. Yeah. And I'm so glad that people are focusing on this more. I think there's a real push to start to bring things back to focusing on the mom,
Hmm.
because I know in my experience, it's like once that baby comes, it's all about the baby, and mom's needs are now suddenly suddenly
Right.
pushed aside, and that, like you said, can feel very lonely. So,
Definitely.
are there specific tips that you think can help to make this transition run more smoothly in general?
Good question. So I think first and foremost, like many things, perhaps mindset could help.
Mhm.
In a sense that uh, we all are probably familiar with work burnout. Parenting as well has a term of parental burnout. And a big concept for parental burnout is the imbalance between the challenges, the stress of parenting with the resources, like you mentioned. So especially for high achievers, for high
Mhm.
performers, sometimes it could feel very hard to admit that we need help, or if someone offers help, to accept them.
Right.
But first tip I have would be try your best to accept it. It takes a village to raise a kid. I think it's very true in terms of. I very much agree with that saying. The second tip that I have is, I know it's very, very hard, like you said, especially in the thick of fourth trimester or just in general, where we as moms always put everyone else's needs perhaps first before our own. But self-care is very important, and having a sustainable, lifestyle instead of just one-off lifestyle techniques is very important. If you
Hmm.
can, exercise could very
Mhm.
much help. And again, I know firsthand that having the time to exercise is almost like a myth, right?
Right.
It's sleep itself is very much difficult, let alone exercising on top of everything that you have to do and juggle in your plates. In terms of the current CDC recommendations right now, what could benefit in terms of mental health too is aerobic exercise, which essentially just mean any sort of movement that could raise up your heart rate. So that doesn't have to be a dedicated hour at the gym, but
Mhm.
perhaps you can, do chores, lifting things here and there around the house, as long as you get that heart rate up. How intense? Moderate intensity is recommended, which means that you can probably still talk but not sing flawlessly during the exercise. And how often? 150 minutes at least per week, or give or take half an hour Monday to Friday, might be a good thing. So with exercise and all these lifestyle techniques and life in general, I think some is always better than none. So please don't beat yourself up if you're unable, especially as new moms, if you're unable to work out, Monday to Friday, or just get the house clean, get those clutters out of the way. 100%, some is always better than none. So for me, what I found helpful after the kids in terms of exercising, when the weather allows, I go on a
Mhm.
family walk. So just put the babies in the stroller, walk with my husband and my puppy, get some fresh air after that long day of work, or just to relax a bit. That way I could get my heart rate up a little bit by walking a little bit faster, and then get some family quality time to as well in there.
Yeah, very efficient.
Trying
Killing
to.
killing 2 birds with 1 stone.
Right, right.
Yeah, that's really interesting to me, though, because I think that when people are going through a stressful time, when we think about exercise, a lot of people first think about something like yoga or something that's known to be kind of more relaxing, but it's
Right.
interesting that the first thing that you're mentioning is something aerobic. It's not what I would have expected you to say.
To your point, actually, yoga, of course, is very much beneficial as well. I think in terms of the types of exercise, aerobic just happened to be one of the most well researched exercise
Gotcha.
types out there so far. But other things, lower intensity exercise like yoga, strength training, also do have mental health benefits. In general, how can exercise help us in terms of in the psychiatric space? In general, it's has biopsychosocial benefits. So biologically, it induced this BDNF, or brain-derived neurotropic factor, which essentially is the miracle grow to our brain that helps that nerve cells in the brain just to develop, to function well, and whatnot. It also helps with the brain chemicals, neurotransmitters in our brain, as well as having that physical health benefits in general too. Protects against chronic conditions, right? Like high blood sugar, high blood pressure, and whatnot.
Mhm.
Also, psychologically, it adds that sense of self mastery. So, especially for new moms or moms, whenever you're feeling that much out of control, exercise could add that sense of mastery, which helps with self confidence in general as well. And then socially, it does induce that social stimulation that also help with the brain and mental health, as well as preventing isolation, which is very common in depression, anxiety, or a lot of these mental health challenges too.
Yeah, yeah. Right. I mean, in terms of efficiency, I just throwing out there, like I know in my community, there are quite a few options that are specifically fitness programs to, with other moms, perhaps, taking a walk
Right.
with the strollers or, all sorts of things like that. So that could be a way to, get some social input, actually talk to adults. I
There
think
you
that's what
go.
people miss.
Yes.
Yeah. Um, so I'm curious, in your practice, do you usually actually talk to partners as well? Not necessarily like a couples therapy sort of thing, but it seems to me that the partner is so integral to this woman's support and recovery and all of that. So it seems like I know it was tough for me during COVID when I would see at the beginning of COVID when the partners couldn't come in. And I'm
Mhm.
here, talking about breastfeeding, and this person who needs to also be learning about this and knowing how they can help isn't even here. So I'd imagine
Right.
it's maybe similar in with what you do.
Yeah, that's a very good point. So for us, it's not that often that the partner come in. Although if a mom bring their partner and is comfortable to have the partner sit in during the session, it's very much allowed or even encouraged in that case. In this case, right? Because like
Mhm.
you said, social support, especially partner support, is very much integral in parenting and just navigating this huge life change essentially. In fact, parental or spousal or a partner support is one of the key factors that might affect if someone, a parent, might develop parental burnout or not.
Hmm. Mhm. Actually, that also brings up the question of what about supporting that partner too?
Mhm. Right,
Because,
right,
I know the partner sometimes can feel like they can't help, or especially like with breastfeeding moms, the partners like, what
right.
can I do? Do you sometimes see the partners themselves?
That's a very good question. So far, I don't think the partner come in specifically just for that reason,
Yeah.
but
Yeah.
after getting to know each other a bit, sometimes it does came up, that having a new child at home or new baby at home or new um, life changes such as those could
Mhm.
be very much the stressor, or at least a factor that affect someone's stress level, which is very understandable. But like you mentioned, the partner often also have certain needs after these life changes that is not as often addressed. In fact, traditionally, for those out there, you might be aware of the statistics. 20%, so 1 in 5 moms might develop mood or anxiety disorder in this period, but the partner, so traditionally the dad, 10% could also develop similar
Yeah.
condition as well. So it's not very uncommon
Yeah.
in that sense.
Yeah. So, that's also why I think it's good to have people who are really focused on this, because it is such an all-encompassing situation, and there's so many
Right.
people involved, and I think people who maybe don't deal with this every day aren't going to think about all of those other factors that are part of it.
100%.
Yeah,
Absolutely.
yeah. So, I'm curious, um, for somebody who's really struggling and maybe doesn't recognize that that's what's going on,
Mhm.
and or somebody who has the postpartum blues and not quite, hasn't quite tipped over to depression or anxiety, and they're still functioning, but they're really having a tough time. So we talked about how exercise can help. Are there other specific tips that you can give people who might be watching this today?
Yes, absolutely. So I'd like to touch upon stress and
Mhm.
how to effectively manage stress in this very demanding slash busy sort of
Mhm.
lifestyle. So three of my favorite portable stress management techniques are as
Very
follows. And I
key.
said, right, or keys. And I said
Yeah.
portable because it's literally can be done anytime, anywhere. Especially as moms, while perhaps chasing your toddlers during breastfeeding, changing diapers, what have you. So the first one is intentional slow breathing. So breathing with your diaphragm, essentially, or your belly. I like to count to six while inhaling, six while pausing, and six while exhaling, and repeat it a couple of times. Why can this be helpful? So stress or anxiety is often associated with our fight or flight system, which also affects a lot of other things in our body. For example, it also increases our heart rate, our respiration, our muscle tension, and also activates the brain areas that are more related to fear versus more related to clear thinking. So, what
Okay.
deep breathing does, it switches that focus of fight or flight to the opposite system, which is called parasympathetic system, and help relax us in those number of ways.
Mhm.
The second tip that I'd like to offer is what we call in psychiatry progressive muscle relaxation, or PMR. So for this, I like to go muscle group by muscle group gradually from the top of my head all the way down to the bottom of my feet. So let's take the muscle group on the top of my head first. We intentionally tense it for 10 seconds and then relax it for 20 seconds before we go to the forehead, to the cheek, to the jaw, to the neck, shoulder, and so forth. So, because anxiety is associated with muscle tension, doing this muscle relaxation can help with anxiety as well as anticipation anxiety and a lot of other mental health outcomes such as improving mood, improving concentration, relaxation, sleep, and so forth. And the third thing that I'd like to touch upon today is grounding techniques, which is also very common in psychiatry. So let's say basically we're trying to switch over the focus from our mind to our five physical sensations: to see, to smell, to taste, to hear, and to touch. So let's say in a room, I have this water bottle as an example. So I pick it up, I try to observe it, see how it looks like, how if it's half full, half empty, and then perhaps when I pick it up, hear that crinkly sound that it made, feel how it feels against my fingers, and then I open it, smell it. Hopefully, it doesn't have any smell before I drink it, and focus on the taste. So similarly, what it does, it just helps with that system as well as improving a lot of other mental health outcomes, as mentioned, such as concentration, mood, and help us reset and be more mindfully present um, in that way.
Wow, that's fascinating. That's very cool. And all three of those things clearly slow you down.
Yes,
And I
exactly.
think that's, it's um, one of the things that I think everyone hears about in parenting is, count to 10 before you respond. And that's
Right.
the thing, I mean, our emotions can really just compound things, and it can be kind of a vicious cycle. We can feed the fire with our emotions too. And so counting to 10 allows you, or doing these techniques can allow you to just take a step back, ground
Hmm.
yourself,
Ground yourself,
and
exactly.
yeah, and move on.
Right.
That's
And
really
especially
interesting.
now, as a new mom of two under two, when the newborn scream and the baby, the
Oh
toddler
gosh.
scream, it's very necessary to, like you said, to kind of slow ourselves down
Yes,
um,
yes.
during that time.
It's funny, we were kind of billing this talk as perinatal mental health specifically in relation to high achievers, but are there any moms who are not high achievers in that context? I'm
I
not
don't think
sure.
so.
We all kind of want to be the perfect parent, right? And
Exactly.
I think if there's one thing that I have learned as a parent is that there is no such thing as being perfect. And we
Right.
do the best
Right.
we can with what we have. And that's not always what we had in mind.
Right.
And it's okay to kind of realize that we're not perfect. And I
Yes.
think kind of coming to terms with that will then help us not only be a better parent, but be it extends to the rest of our lives too,
Yes. For
for
sure.
sure.
For
Yeah,
sure. I very
yeah,
much agree with that.
yeah.
Although it's very hard
Um,
to do.
right, absolutely, absolutely. Are there other things that you think are specific points that you want to make in relation to high achievers?
Right. I really appreciate that you bring that kind of wanting to be perfect, perhaps perfectionism into the play as well, because a lot of high achievers, in different types of fields, most if not all, perhaps have that perfectionistic tendency or traits to some extent, and such just like partner support, having a perfectionism tendency could actually, or is actually a very much big risk factor to parental burnout. Um, so, although it's very, very hard and very challenging day in and day out, have lowering perhaps lowering that expectation that we have for ourselves in terms of just ourselves in general or how we parent our kids is very
Mhm.
much key for our mental health. Uh, what could help perhaps is just keeping things in perspective. Again, for me, the saying "some is better than none" also applies in this
Yeah,
context.
Yeah.
Just reminding ourselves day in and day out that no one's perfect. It's all just an illusion. If you think that other moms out there are perfect, or um, things like that. Social media these days, especially during
It's
COVID,
hard.
perhaps create comparitis, right?
Mhm.
That is not helpful for our mental health in that sense as well.
Mhm. Actually, I got a good tip recently of, if there's a specific person on social media that you're always comparing yourself to, and that really, you can tell that you get upset by those
Right.
comparisons that you're making, take them out, block them, unfriend
Right.
them, whatever, because that's the kind of thing that really, really can bring you down. And it's such an easy
Yes.
little fix that I think a lot of us don't realize. We almost get addicted to that
Right.
comparitis and
Right.
almost seek it out. But what we have to do is very, very deliberately s- get those negatives out of our way.
Right. And I love how you frame it, deliberately get those negatives out of our way, right? Because I think it plays into this concept of psychological priming. So the more we see it, automatically
Mhm.
our brain would get into that space. And in this case, it's comparing, comparitis.
Right, right,
And we just unconsciously forget that things that got put up in social media has been selected, so to speak, to reflect the best of all kind of situations, right?
right,
So it's not 100% what it is, so to speak.
right, right. This is fascinating. It's so helpful. And I think that just the more we talk about this, the more it will help to remove the stigma that I think
Mhm.
has been there for so many years. Thankfully, I think the next generation, younger kids are, it's kind of like everybody's in therapy. And so I think they're going to
Right.
actually do a better job of seeking out the help that they need. We need more people to go into the field to help people because there unfortunately is a shortage. Um, but, if you're looking for help, again, as I mentioned, you can talk to your physician, your OB, your midwife, your pediatrician, your PCP. But there are mental health specialists out there like Dr. Pospos and therapists out there who specialize in perinatal mental health. And so, not that you need to seek those specific people, but that may be something to take into mind. I think a lot of people don't even realize that there's a specialty there, and that's something to
Absolutely.
consider.
Right. And I think also, especially as moms, perhaps some of the main concerns, let's say in terms of psychiatry or taking medications, right, that when you're pregnant, it may affect the baby in some ways, or
Mhm.
when you're breastfeeding, it may affect the baby as well. And, in addition to just having those periods be or put us at a higher risk than usual to all these mental health challenges,
Mhm.
like burnout, depression, anxiety, and so forth. So having that special training in perinatal mental health, I think really helps to just recognize perhaps those nuances when dealing with this type of challenges specifically.
Right, right. Yeah. I mean, I hear about women who have underlying anxiety or depression, and then they go off of their medicines during pregnancy because they're worried about how it's going to affect the baby. And that's going off of these medicines that are helping you right at this super, super stressful time of life.
Yes,
That can be
yes.
tough. So finding, if you're in that situation, maybe there's an alternate medication that you could try even before you get pregnant
Hmm.
to,
Hmm.
have that on board. Or maybe it's actually safer than what you've heard and you could still take it with during the pregnancy. A lot of things are risk benefit. And
Absolutely.
having the conversation with somebody who has that extra training, I think, can be super helpful.
Definitely. At the end of the day, it's just weighing that pros and cons, right? Risk benefits, and then make yourself make an informed decision after you understand all this risk and benefits associated with your decision.
Right, right. Well, this has been so wonderful having you talk about this. And before we go, are there any other comments that you wanted to make on the topic?
Yes, so I just want to mention to everyone's listening again, mental health is just as important as your physical health. And
Right.
these periods, whether you're moms to be trying to get pregnant, or you're pregnant currently, you're currently expecting, or you just gave birth recently, or not so recently,
Yeah.
just just having to take care of the kids and put your family needs at first can be so difficult, lonely. You might feel trapped as well. Burnout, feeling overwhelmed is very common, but again, you don't have to suffer alone. Help is just a click, an email, a phone call away. If you found yourself having these two red flags of having intense distress over the symptoms or having the symptoms interfere with your day to day life, please reach out for help. If you're in California and don't have a local psychiatrist, please feel free to reach out to me. I see patients via telehealth as well, so you don't have to be present here because mom's life
Hmm.
is very busy.
Yeah.
So please reach out to Lifestyle Telepsychiatry. I'm on Instagram or to my website. And if you're not in California, I do offer additional resources for those out
Great.
there at my website, lifestyletelepsychiatry.com/subscribe.
Great. And I will put that in the notes as well in the comments so that people know where to find Dr. Pospos if they need her, want her help. And you can tell that she's, an amazing doctor and so supportive. And having somebody like her on your side, I wish I had somebody like her on my side when I was going through this.
Likewise, and I just
So,
want to shout out to Dr. Ruben as well, whose video had helped me a lot.
oh,
I recently mentioned to her
oh,
um, on clock ducks on breastfeeding. So if you're a new parent, if you're
great.
parents, if you're a breastfeeding parent in the area, please reach out to Dr. Ruben, and you're gonna
Aw.
have the best care.
Thank you. Well, it has been a pleasure, and hopefully we'll have ways to meet each other and collaborate more in the future. And please reach out, get help if you need it. Like Dr. Paspo said, it's just a click away.
Absolutely.
All right. Well, have a wonderful rest of your day. And thank you so much for coming on. It's really been a pleasure having you.
Thank you. Thank you so much, Dr. Ruben, for having me. Really appreciate it.
Absolutely. Absolutely. Bye-bye.
Have a good one. Bye.
Bye. And I will post this as a replay if anybody missed part of it and wants to catch the other part. I will post it both. There will be a link on Facebook, but as well, it'll just kind of live on YouTube if anybody wants to access it. All right. Bye.
Bye.